Today we are starting a series of lectures on hematology, right? And we'll start with the red blood cells, especially the most common investigations which are done in cases of anemias or polycythemias, right? So let's start discussing about red blood cells and related investigations. The important terms which you are supposed to know, right? The important terms, medical terms which you are supposed to know are: number one, you should know what is meant by packed cell volume, or it is also called hematocrit. Hematocrit. You should be clear what it is after the lecture. Number two, you must know what is the concept of hemoglobin concentration. Hemoglobin concentration. Number three, you must be clear about red cell count, right? After the lectures, you must be clear in all these terms which I am writing there. Then you must be knowing what is meant by, yes, you must be knowing what is meant by mean corpuscular volume. Mean corpuscular volume. Okay. Someone is so intelligent, he told that it should be called MCV, mean corpuscular volume. Then you must be also clear about mean corpuscular, yes, very good, hemoglobin, which can also be called MCH, mean corpuscular hemoglobin. Then by the end of the lecture, we should have very clear concept what is meant by mean corpuscular, yes, mean corpuscular hemoglobin concentration. Right, and then we will, that is of course mean corpuscular hemoglobin concentration, MCHC, right? And then another term which is used now these days, that is, yes, there is one term, you will tell me what is RWD. Yes. Okay, RDW. Yes, RDW. What is this? Anyone who knows about it? Never heard of it? Red cell distributive width. I will explain it later what is really meant by that and what is the importance of this term. Red cell, yes, distributive width. Right, so how many of you are clear about all these terms? Raise your hands. I should remind everyone has two hands. You can raise only one. Anyone who is clear about all these terms? Okay, someone who is sure about first 6 terms. Anyone? Yes, there are a lot of young doctors. You know what are the differences in these terms? What are the importance of them? Because still when we'll be moving forward, there will be more terms which will be made clear to you. For example, by the end of the lecture, you must be clear about what is meant by microcytic, yes, microcytic corpuscles or red blood cells, microcytic cells, then yes, normocytic cells, then there should be, you should be clear about, yes, macrocytic, very good, macrocytic red blood cells, and then you should be also clear what is meant by normochromic, yes, normochromic cells, hypochromic cells, red blood cells and yes, hyperchromic. I think if after the lecture you are really clear about these 13 terms, I think we have done the job of today, right? So let's start here discussing, and during this discussion I will explain every term, right? Let's suppose we take a blood from a person, from his vein, and we put into this tube. Let's start studying this situation. Suppose this is a container, and in this container we take blood from a person and we put blood into this container, right? Suppose blood is up to this. We anticoagulate the blood. We anticoagulate the blood so that blood does not coagulate, right? We anticoagulate the blood and then centrifuge it. So naturally what will happen? If blood is anticoagulated and put into a tube and then there is centrifugation, it is rotated, naturally cells will come down and plasma will remain up. Good, you know these things. Excellent. So what happens? The cells will settle down. So once you have centrifuged, let's suppose it was 1 unit blood, right? After the centrifugation, when you let the cells settle down in a healthy person, this is the area or volume which is occupied by the cells, and area which is above that is occupied by cell-free, yes, plasma. Is that right? Now these are the cells. This all is mostly red blood cell. There are some cells here, we call it buffy coat. This is actually a very thin layer which is made by white blood cells, right? And above that, all this is, yes, all this is plasma. We start our concept from very basic. You have taken a blood from a person, anticoagulated the blood, put into a tube, centrifuged it. You have reduced a cell to the bottom and plasma is at the top. Is that right? Now, let us suppose if this was 1 unit blood, as you know, blood is made of what? It is having plasma in the cells. So naturally, cells are less than 1 unit. Usually in a healthy person, about 40 to 50% are cells. 40 to 50% of the volume of the blood is occupied by cells, and they are mostly red blood cells. Is that right? So we can say that this, out of this 1 unit, all this is present here. Let us suppose it is 0.45. 1 unit was like this. It was 1 unit volume. Out of that 1 unit volume, 0.45 is occupied by red blood cells when they are packed together. When they are packed together. Then we can say 0.45 is the volume occupied by the red blood cells when they are packed within the blood. Let me repeat it. What I'm saying, that let's suppose, okay, let's make it 1 liter. If this is 1 liter blood, don't remove 1 liter from anyone. It's just an example. 1 liter blood with centrifuge and settle the cells. Out of 1 liter, how much will be occupied by red blood cell? In this diagram, out of 1 liter, it is 450 mLs. Or we can say 45% of the total volume of the blood. Right? So what we can say, or we can say that total volume of the blood which is occupied by red blood cells once they are packed together, right? This packed together, this is 0.45 liter of the cells per liter of the blood. That in 1 liter of the blood, 0.45 liter is the packed volume of red blood cells. When red cells are packed, this is very important. I'm repeating again when they are packed. So what is this? Packed volume of red blood cells. Is that right? Now, this is 0.45. Simply when liter by liter, or we simply say 0.45. Even you can put, if it is 1 ml, then you will say ml by ml. That in 1 ml, 0.45 ml is the volume occupied by the red blood cells when they are packed together. So this volume is called packed cell volume. What is this? Packed cell volume. For next time, when someone say what is packed cell volume, PCV, he is talking about the volume in the blood occupied by the red blood cells when red blood cells are packed together. Is it difficult? It's so easy. Packed cell volume. Is that right? Okay, thank you for understanding that. Now, some people don't want to call it like, there are always lazy people. They don't want to call it 3-word, packed cell volume. So they introduced a different term for the same concept. And our young doctor gets confused. The other term for the same thing is hematocrit. Packed cell volume is actually the other name for hematocrit. So what is hematocrit? If I say my friend has hematocrit 0.4, it means in his blood 40% of the volume is occupied by red blood cell. If I say there is a person who has very severe anemia, I say his hematocrit is 0.3. If I say my friend has, we take a blood sample from a patient and report come, hematocrit is 0.3. You can understand very clearly that in this person's blood, out of 1 unit, 30% of the volume of the blood is occupied by the red blood cells when they are packed together. That's it. So I hope you are clear about these terms. Okay, thank you for understanding it. Now, I will make it a little more clear because I want to talk about other terms also. So let's suppose I make the container here again. Let's suppose that here is packed cell volume. Okay, this was our total blood volume, right? We decided that packed cell volume in our patient was, yes, 0.45 liter per liter. Is that right? And this was made of mainly by which cells? Red blood cells. Let's suppose I'm putting the red blood cells here. I'm just putting few red blood cells here. Now I've made only 5 red blood cells in this diagram, right? Actually there are not 5 red blood cells, there are a lot of red blood cells. But these 5 red blood cells in our diagram are representing all the red blood cells. Of course, packed cell volume consists of what? Consists of red blood cells. Now, when we talk about that this is our packed cell volume, within this volume we can talk about other things. Because packed cell volume only tell us that out of the full unit of the blood, 45% is occupied by red blood cells. But someone can come and ask, okay, this is the volume occupied by all the red blood cells. But what is the number of red blood cells? Because there are many red blood cells which are put together and then this volume is occupied. So it means we need one more term. That in a given patient, number one, we should know what is the hematocrit. Hematocrit means packed cell volume. Plus, you can also ask what is the red cell count. Red cell count means that in 1 unit of blood, what is the number of RBCs? And of course, in 1 unit of the blood, whatever is the number of RBCs, they are put together making a volume which is called packed cell volume. Or we can reverse the statement that within the packed cell volume, we should know what is the number of RBCs. Is that right? Now first normal, let's suppose our person is normal. In a normal person, in 1 ml of blood, let's suppose this is 1 ml of blood. In 1 ml of blood, how much is the packed cell volume? 0.45. Is that right? Of course, 0.45 ml. If we are not talking about liters, now we are talking about unit of 1 milliliter. But how? In 1 ml, in 1 drop of blood which is just 1 ml, what is the number of red blood cells? Yes, my friend. You never had time to count it. Yes. Anyone? I'm asking, if you take 1 ml blood from me, if I'm healthy, out of that 1 ml blood, 0.45 ml will be packed cell volume. In that 0.45 ml of the blood, how many number of RBCs are usually packed together in a healthy person? You don't know it. Yes. 5,000 to 6,000 to 10,000. Believe me, everyone who has such a number of RBCs in 1 ml of blood will never take this lecture because he will be dead. Even person who has only 5,000 to 10,000 red blood cell in his blood will never come to your attention. His report will never come. He must be already dead. Yes. Yeah, millions he is talking about. You are very right. As far as red blood cells are concerned, you are a millionaire. In every 1 ml of blood, in every 1 ml of the blood, you have approximately 5 million RBCs. In 1 ml of the blood, there are approximately 5 million red blood cells. Of course, male have a little more and female have a little less. We'll talk about those variations later. First, I'm putting a basic general concept. So, it means when we are talking about red cell count, when we are talking about red cell count, what we are trying to talk? We are talking in a given volume, what is the number of red blood cells, and we just discussed in a healthy person in 1 ml of the blood, there are approximately 5 million red blood cells. So, in a way, red cell count is the number of red blood cells in a unit volume of blood. Is that right? So now, if we continue our discussion with this thing, let's suppose a very small tube and this is total, okay, how much you want? 1 ml, 100 ml, 1 liter tube. I'll leave it up to you. 1 liter. Who wants 1 liter? It's not Coca-Cola. My friend, it's blood. Don't draw it more than 100 ml here. Okay. Let's suppose this unit is 100 ml. Now again, I will just see you have developed the concept or not. If it is 100 ml blood from a normal person, how many mLs will be the packed cell volume? Approximately? Listen carefully. If this is 100 ml blood from me, in 100 ml of my blood, RBCs will occupy how much volume? 45 mL. Now I'm talking about volume, not number. This is what I want to put in your mind. These two terms are different. Is that right? So, and in this one, I told you in 1 ml of the blood, how many you have RBCs? 5 millions in 1 ml. And in 100 ml you will have 500 millions. Good, your math is good, right? So, it means in this case, if it is 100 ml blood, 45 ml is the packed cell volume or hematocrit. Is that right? 0.45 liter per liter. And what will be the red cell count? What will be the red cell count? In 1 ml it is 5 millions. In 1 ml. It is 5 million? I'm not good in math. Okay, thank you. So it's 5 million. It is in 1 ml. 100 ml into 100. So now you understand there is a difference of the concept of packed cell volume or hematocrit, and there is a different concept of red cell count. Why it is so important to understand? Listen carefully. Sometimes what happens? A person has very low packed cell volume. Suppose someone is severely anemic, his packed cell volume may be very low. Let's suppose this was me normal, there is another person, my friend, and unfortunately he has anemia, and still I have one more friend, unfortunately that person also has anemia. Now, when we took 100 ml blood from both of them, the packed cell volume was only 25.25, and here it is also 0.25. It means their total red cell mass is reduced. Rather than 45% in the blood, their red cell mass is, or red cell packed cell volume is only 25. Is that right? But look, if I say this person has larger RBCs, very large size RBCs, and this person has very small RBCs. When RBCs are larger than normal, we call them macrocytic, macrocyte. When RBCs are significantly larger than normal, we call them macrocytes. And when RBCs are smaller than normal, we call them microcyte. Now look, this is a very important concept. These two people, both of them have anemia, but one has an anemia with macrocyte, other has anemia with microcyte, and if both of them have equal packed cell volume, do you think red blood cell number can be equal? No. You are intelligent, isn't it? There are two people, both of them have severe anemia, both of them have very reduced but equal packed cell volume. Packed cell volume is equal on both sides, but one has larger RBCs, other has smaller RBCs. So it means RBCs, if packed cell volume is equal, it means same volume of the blood is occupied by the red blood cells in both patients. But here, given RBC, individual RBC is larger, their individual RBC is smaller. It is just like all of them are like grapefruits, and these are like small lemons. So naturally, if grapefruits and lemons are having the same packed cell volume, then number of grapefruits will be less and lemons will be more. So what I wanted to tell you, that just knowing the packed cell volume is not enough. You should also know that in a specific patient, a given packed cell volume is having what? Red cell count. Here red cell count will be less. Here red cell count will be more, even though hematocrit is equal. Am I clear? No problem. It can also happen that you come across two patients, both of them have equal number of RBCs. Red blood cell count is equal. Look, another example. There are two friends here, right? Number of red blood cell is equal, but one has larger red blood cells and other has smaller red blood cells. This person has smaller red blood cell, another has larger red blood cells. For here, if number of the red blood cell is equal, then person with larger red blood cell will have more packed cell volume, and person with smaller red blood cell will have less packed cell volume. Do I need to explain it further, or you understand it? So what I wanted to put in your mind, that when you look at a person, he has low hematocrit or normal hematocrit, it is not enough. To have the real concept of his red blood system, we should not only know that in a given volume of blood, what is the packed volume, right, occupied by RBCs, we should also know per unit of the blood, what is the count of RBCs. Is that right? Any problem here? Claro? Okay. Now we go to the normal. We now go back and start working with the normal person. Now you know the concept of packed cell volume and you know the concept of red cell count. And now I want to give a concept of hemoglobin concentration. Is that right? Because they are interrelated but somewhat different concepts. Now what is the fine-tuning in the concept? Let me do it for you. let's suppose we have taken 1 unit of blood from a person, and out of that, this is his packed cell volume. Let's suppose normal person, it is 0.45. Normal person has a range, but let's suppose in this given normal person, packed cell volume is 0.45. And red cell count is, yes, 5 millions, yes, 5 millions per ml. Is that right? Now, I will draw the RBCs here, just 5 red blood cells here. I think I need to really. Okay, so it's a very simple diagram, right? This was a tube and plasma is up to here. It was 100 and here it was 45. Is that clear? Now, these are, of course, in such amount of blood, there are not 5 RBCs. Actually, I have drawn in the diagram 5 RBCs which are representative of all RBCs. For example, if it is 1 ml, then there should be 5 million RBCs. Then 1 RBC is representing 1 million red blood cells, right? Now look, within these RBCs, there is hemoglobin. I take 1 RBC and put it here. This is 1 red blood cell. I make a section of this red blood cell here, and I will show you the hemoglobin. Now, hemoglobin is present within these red blood cells. Every red blood cell has some hemoglobin. Is that right? Now, when hemoglobin is present over here, so naturally all these red blood cells are the bags of hemoglobin. Red blood cells do not have any nucleus. Now, this is hemoglobin. Now, actually, red blood cells are not 100% full of hemoglobin. This is very important. Red blood cells are not, red blood cell is a bag of hemoglobin, but this bag is not 100% full. About 1/3 of it is loaded with hemoglobin. Is that right? So it means, why normally a red blood cell fluid has only 1/3 of it full of hemoglobin? Because this is the maximum metabolic capacity of cells to make the hemoglobin in a given RBC. So usually when RBC synthesis is normal, the maximum amount of hemoglobin which can be packed during the erythropoiesis, the maximum amount of hemoglobin which can be packed in 1 red blood cell is about 1/3 of its volume. It means 1 RBC is 1/3 full of what? Hemoglobin. Is that right? Now we come back. Packed cell volume you know. Red cell count you also know. Is that right? Now I will repeat the things. In a given unit of blood, all volume occupied by the red blood cell once they are packed is packed cell volume or hematocrit. And in a given unit of blood, the total number of RBC is called red cell count. But we did not talk about hemoglobin. Every red blood cell is having hemoglobin. Sometimes we talk that in 1 unit of blood, what is the total percentage of hemoglobin? For example, if it is 100 ml blood, we took from patient up to here was 100 ml blood, then there were 45 ml volume occupied by RBCs. Hemoglobin is present within the red blood cells. Can hemoglobin be more than the total volume of red blood cells? No, of course not. So it means whatever is packed cell volume, hemoglobin has to be less than that. And I told you, in a healthy person, when there is healthy normal, good erythropoietic process is going on, usually a normal red blood cell can be maximum packed with hemoglobin up to equal to its 33% of its total volume. Now, right? You are understanding it? Now, it is total 45 ml. If I say in a healthy person, you have taken 100 ml blood, out of 100 ml blood, packed cell volume is 45, and 1/3 of that is full of hemoglobin. What should be the amount of hemoglobin? 15 gram. Look, this, if I put all RBCs together, it become a bag of RBC. Is that right? If total bag of RBC is how much volume? 45. If I say this bag is 1/3 full, then what should be the amount of hemoglobin? Right? 33% of RBC, but 15% of the total blood. You are understanding? Total blood was how much? 100 ml. 45 ml was what? Packed cell volume. 45 ml packed cell volume was containing 1/3 amount of hemoglobin. So 45 ml was containing how much hemoglobin? 15 gram. So out of 100 ml there was only 15 gram what? Hemoglobin. So in a one amount of blood which was 100 unit, only 15 unit was hemoglobin. So we can say if out of 100, 15 is only hemoglobin. So what is the concentration of hemoglobin in blood? 15%. Right? So this is the concept of hemoglobin concentration in a healthy person. In males a little more and females a little less. But let's suppose 15%. Or simply we call it, if 15 gram per 100 ml deciliter or 150 gram per liter. Is it difficult to understand? Clear? So three terms are clear now. That a patient come and you want to make some study that patient has anemia or not. What type of anemia is there? First of all, you must know what is the packed cell volume. Number 2, you should know what is the red cell count. Number 3, you should know what is the hemoglobin concentration. Sometimes what happens? That there are two patients, they have same red cell count. It is quite possible there are two patients. There is one patient, this is another patient, and both of them are having, there is packed cell volume, full blood. Here is packed cell volume. Is that right? Both of them are having same packed cell volume and both of them having same what size of RBCs and count of RBCs. Now, in both cases, packed cell volume is same. In both cases, RBC count is also same. But here RBCs are less juicy. They are under hemoglobinized. They are having less hemoglobin per RBC. And let's suppose their RBCs are very, very juicy. Yeah. They are like oranges. Very, very juicy here. Right? Well hemoglobinized RBCs. Now, packed cell volume is same. Red cell count is same. But do you think hemoglobin concentration can be same? No. So it means that is an independent variable. You should not know that number one, you should know in a given person what is the total volume of the blood occupied by red blood cell. Secondly, you should know in a given volume what is the number of RBCs. Then you should know what is the juiciness of RBC, mean how well or how poorly they are hemoglobinized. Is that right? So when we talk about this juiciness of RBCs, is that right? We are talking about content of hemoglobin, right? So in all, it is quite possible that there are two patients, both of them have packed cell volume 0.4, both of them have red cell count 5 million per ml, but one has hemoglobin 15 gram, other has hemoglobin 12 gram. So in one case there is better hemoglobinization per RBC, in second case there is poor hemoglobinization per RBC. It means in first case hemoglobin was 15 gram, in second case hemoglobin was 12 grams. You are understanding it? So we should have three basic study when someone come to you and we start talking about RBCs and hemoglobin business. Number one, what is the packed cell volume? Number two, this packed cell volume is how well packed with what number of RBCs. Then what is the hemoglobin concentration given amount of blood, right? So now we will have a break. I hope you are clear about these three terms. These are three basic terms. Once you know these three basic concepts about a given patient, then you can derive these concepts, all these. I will talk about them after the break.